Migraine affects 12% of the global population, including children. Although the severity of symptoms varies among the nearly 1 billion people who suffer from the disorder, migraine ranks as the most disabling disease in people under 50. Fortunately, a promising new class of drugs for the treatment of migraine is on the horizon. Monoclonal antibodies against calcitonin gene-related peptide or its receptor. Researchers are also gaining ground on the genetic origins of migraine, and therefore biomarkers for targeted precision therapy. As such, personalized care practices are becoming more commonplace. Much work, however, remains to be done. A special collection of review articles on migraine, published in the Journal of Headache and Pain in collaboration with Springer Healthcare Independent Medical Education, explores the changing face of migraine and examines where researchers are today in meeting the long-standing unmet need for individualized and targeted approaches. In this themed series, Paolo Martelletti, Masoud Ashina, and Lars Edvinsson introduce a comprehensive body of work that explores the genetics of migraine. A review, for example, covers the advances in understanding the genes and genetic variations implicated in migraine etiology. That and similar work naturally raise questions about targeted therapy, many of which are addressed by researchers. The team discusses recent data on promising anti-migraine therapies on the horizon. Meanwhile, there is research examining the prospects of polytherapies that tag-team the treatment of migraine and common comorbidities. Of course, at the core of any treatment is the patient and his or her quality of life. In this vein, a nuanced perspective looks at the impact of migraine on work life and everyday activities, as told by those who suffer from migraine disorders themselves. This collaborative article series represents the frontier of today's migraine research, surveyed by some of the world's leading experts. The collective knowledge gathered here serves as a guide for those navigating through the complexities of migraine disorders in the clinic and beyond. To read the full selection of articles, visit the journal website. Click on the link below.